We're going to be live. 3, 2, 1.
Good evening. Chair calls to order public hearing for Resolution 028-20, pilot agreement, Windsor Valley 3 Apartments. Council, we're going to recognize and welcome Mr. Rob Sandless, our County Treasurer. Good evening, sir.
Good evening. Welcome, County President, members of the council. Bringing forth a proposal from the County Executive for a pilot, which stands for Payment in Lieu of Taxation, for the Windsor Valley Phase 3 apartment building. Under state law, the county has the ability to grant a pilot, which is something that can be in excess, up to the level of the level of property taxes. Under certain unique circumstances, most notably, and in this case, for lower income housing. So the terms of this pilot are 283 units, and the pilot will be set at $505 per unit. Currently, that would generate the revenue of about approximately $142,000 to $143,000. That is in line with what the property taxes are. So at this point, the pilot would be more or less revenue neutral. But the owners of this unit, of this complex, are looking to do some substantial renovations, and with that, you would probably see property tax or assessment increases, and this would more or less kind of shield them from those increases, so that they can go forth with their renovations, their expansion, because they don't have the same ability to, say, raise revenues, raise rents that you might find at a more market-rate apartment unit. So we have about 15 of these pilots kind of throughout the county, and kind of for the total cost of all of them, it's about approximately $200,000. So from a revenue perspective, it's not a very significant impact overall.
Is that it, Mr. Sandless?
I believe so. Do you have any questions, kind of just on pilots in general, or in this pilot in particular?
Bear with me just a second, Council. This is your time for questions. Mr. Johnson, do you have any questions at all, sir?
No, sir.
Thank you. Mr. Giangiordano?
Thank you, Mr. Sandless. Can you send us over a list of all the current pilot programs that we have and where they're at?
Yes, and certainly can do that.
Only question, sir.
Okay.
Thank you.
Councilman Giangiordano. Anyone else? Mr. Schroeder?
Yes, I just wanted to say that Councilman Andre Johnson and myself, we did tour this property and went through some units, and we basically walked the entire complex, and it seems like some really good things are going to come out of this for the community. I don't know if Councilman Johnson wants to elaborate on that, but I thought it was very beneficial.
Thank you, Mr. Schroeder. Council, anyone else? Seeing no one else, Ms. Dixon, do we have anyone signed up?
Yes, Mr. President, we have one this evening, Brian Shumway.
Hi, it's Brian.
Good evening, sir. It's Council President Vincenti. May I have your name and address for the record, please?
Yes, it's Brian Shumway, Lane in Scarborough, Maine.
Thank you, Brian. Go ahead and continue.
Great. Thank you for taking my comments tonight for the Vincenti. My name is Brian Shumway. I'm the president of Wishrock Housing Partners. I appreciate your consideration of the pilot agreement, Windsor Valley 3 in Edgewood tonight. Windsor Valley 3 provides affordable housing to 283 families in Hartford County. This pilot excuse me, is a continuation of the agreement that enabled the renovation of Windsor Valley 1 and 2, which houses another 291 families in Hartford County. This agreement will allow for over $16 million of renovations to Windsor Valley 3 and ensure that it remains safe, stable, high-quality, affordable housing for years to come. Included in the renovation are upgrades to the unit interiors, energy efficiency improvements, significant landscape upgrades, playground improvements, and the creation of 15 units specifically designed to meet the needs of the disabled. It also allows us to maintain security features with the property and to fund a service program for residents and their children. Thank you for your consideration of this pilot agreement, and I'd like to encourage you to vote to approve the agreement. Thank you very much.
Thank you, sir. Thank you, sir. Anyone else, Ms. Dixon?
There's no one else signed up, Mr. President.
All right. I want to thank the speaker for his comments. Council, you for your questions. At this time, this will conclude this public hearing for Resolution 028-20. Moving forward, Bill 20-034, appropriation fiscal year 2021 other post-employment benefits. Again, Mr. Salas.
Thank you. So once again, we do this each and every year. We bring forth the OPEB resolution, which is our retiree healthcare trust fund that we've established. Of course, as you know, the county has provided retirement health to its employees for many years. And then back in 2008, it was determined from the Accounting Standards Board that we needed to recognize that as kind of an ongoing obligation, as a liability in the same way that we kind of do with pensions. And there's been several changes since that point. So what that then requires is that we put aside money each and every year in order to be in order to recognize that liability, to both take care of our current PAYGO expenditures for retiree healthcare, but then also for our future healthcare costs. So within the budget which we adopt, we always include the money in there for the current retiree healthcare expenditures, which is around $9 million. But in order to make up the future cost, if you will, to put money aside in our trust fund, we need to put in some additional money, and that's where this $2.5 million comes into. So combined, they make up what we call the annual required contribution for our OPEB. Should note that Harford County is very unique in that we have fully funded this annual required contribution each and every year through good times and bad, through recessions, and now through and if you pass this next week, through pandemics as well. It's certainly something that our credit rating agencies look at when it comes to our bond rating. That Harford County takes care of its obligations and puts aside the necessary funds so that future councils and future taxpayers won't necessarily be on the hook for today's obligations. Should also note that the county has taken, in addition to funding our obligation, we've taken several steps over the years to reduce our ongoing liability. Most notably, back in 2010, all new employees outside of those under the sheriff's office, so outside of the detention center guards, the correctional officers, and the deputies, any new employees were placed into a more or less a 401k style plan, a PEP plan, so we don't have the same obligation to their retirement health care in the future. We've also made some other changes, including how we do our insurance plan, moving away from a kind of a co-pay model onto a co-insurance model. And a big change we made this year for our retiree healthcare is all of those individuals in the that are Medicare eligible, 65 and older. We moved them from a county supplemental plan onto a Medicare Advantage plan. And this is actually something that's been a kind of a win-win for both sides. We think that it's going to save the county about $1 million. We think it's going to save our retirees about $400,000. While at the same time providing some better care. So as we continue to increase the amount of funds in the trust for these future obligations, we've also worked to kind of reduce our future cost as well. So I ask that you approve this trip, being in good standing with this GASB requirement and with this obligation.
Thank you, Mr. Salas. Council, anyone with questions?
Council President.
Mr. Johnson.
Thank you, Council President. Mr. Sanders, good evening and Happy New Year to you. So could you just go over again for me how you've designated some of these funds to fit to fulfill this request?
Well, so you'll notice that we have we're transferring a total of $2.5 million, but we're transferring it from different funds. And that's because each fund is kind of responsible for their share, if you will, of the retirement costs. So the general fund is the largest. That's the 2.1 million. But then also, say, highways is 235,000. Water and source 215,000. Some of the smaller funds there have some small amounts, and that's really just about fund-based accounting, so that we try to make sure that only the people that pay into the water and sewer fund support water and sewer costs, and that includes things like their retirement costs as well. Likewise with the highways fund and the like. And the overall number for our annual required contribution costs we get from actuaries. So they come up and they say $11.8 million is your annual required contribution this year. Of that, we think your current year costs or your pay-go costs are going to be about 9.3 million. Then the difference, this 2.5 is the difference there. And that's the money then that we will put into the OPEB trust because it's for future costs, but we'll be able to invest it in equities and bonds and things like that, things that get a decent rate of return, so that in future years we'll have that money to pay those benefits.
Great. And have you put any risk assessments in, just in case taking away from different aspects of these groups, the unexpected cost of something down the road happening, and you've already taken those funds away from that particular thing?
Yeah, so when the actuaries do their report, and they do one each and every year for us, they take into account a whole host of variables, medical inflation, mortality rate, how the stock market's doing, all of these different factors. And then they come up with kind of what the liability is, and then what we need in order to pay off that liability, and they spread it out over a 30-year period. So all of those factors are being taken in, and then on top of it, and what we try to do is try to invest in a conservative manner. So we have a rate of return which is 7%, which is lower than some other investments, such as like the state pensions, like 7.65. So we purposely kind of go into it being a little bit more risk averse. And again, we continue to try to reduce our liability by taking these actions, such as the Medicare Advantage plan or the PEP plan and things like that. So yes.
Okay, thank you very much. Thank you, Council President.
Thank you, Mr. Johnson. Anyone else? Mr. Wagner.
Mr. Sandless, what was the savings to the county by going to that Medicare Advantage plan?
So it was projected from Aon, and at this point we've only been in it for about 4 days. Right. That it would be about 900,000 for the county and about 400,000 for the employees themselves through lower call. I'm sorry, for the retirees.
Right.
Yes.
Okay. Do you anticipate any further changes to that for the existing retirees in the upcoming years?
Yeah, I mean, I think with that, the county is always kind of reviewing it to see how things are going. When it came time to do this plan, can say that we spent a considerable amount of time with the retirees. My predecessor, John Scott, was very much involved, as well as other John Chauvin, former HR director, all very much involved in kind of working with the consultants, working with the vendors, making sure that they had an understanding. So there was considerable kind of buy-in from this. And again, we do think that it's they were on board. Because we of course had questions, but this is kind of a win-win situation. So we're going to see how it plays out. It's going to take a couple years to see how it plays out.
And the Board of Ed came on board too, didn't they?
That's correct. So the Board of Ed, we have a healthcare consortium, and while the Board of Ed has not been making the same type of OPEB contributions as the county, we've talked about that in the past. They have a much larger liability than ours. They are on board with this, and they will see some substantial savings there as well.
Okay. All right. Thank you.
Yes.
Thank you, Mr. Wagner. Mr. Giangiordano.
Thank you, Mr. Sandless. Happy New Year. Question, what kind of savings have we realized in changing the healthcare plan? It's been over a year. Did they, the actuarials give you the savings on the healthcare plan?
So you mean for the active healthcare? plan. This was a kind of a strange year. So we were to the good this year. But remember, with COVID, there were so many people not doing elective surgeries, and the county is self-insured. Now, I should say, with this new Medicare Advantage plan we were talking about, that's more like traditional insurance. The county, pays a premium, and United Healthcare is the insurer. In the case of the county's plan, the plan you and I are on, it's administered by Care First, and we also do one with Kaiser. But the county ultimately pays its own losses. So some years were to the good, some years were to the bad. This year, we were to the good, but there's a real hesitancy to try to figure out what that means, because again, it was just so hard to get elective surgeries. People weren't going in for all types of procedures during COVID. Unless you really had to. I know there were some. And so I think that this is one of the benefits of our consortium model, is that we kind of have some reserves built in so that we can weather, if we have some good years, we can smooth that out with some of the bad years. So I think it's going to take a couple of years to see how it's all played out, just because of the anomaly of COVID.
Okay. The only other question I have is with the Medicare Advantage program. Some constituents have called, it's probably not your department, more the human resources, that if somebody leaves that plan, they want to go back into a traditional Medicare supplement, they have to be medically underwritten. That's the only, and I'll take that up with somebody else, and just concerns with that. They go in there, they can't move back once they go out.
Yeah, I'll allow HR to deal with any of those of those questions.
Okay.
But
Thank you for the other answer, and hopefully the continuation of the new healthcare plan will see a significant savings as opposed to a continued increase in the expenses. So thank you very much. Happy New Year. Thank you, Council President.
Thank you, Mr. Giordano. Anyone else? Ms. Dixon, do we have anyone signed up?
No, Mr. President, there's no one signed up.
Thank you. Thank you, council members, for your questions. At this time, it'll conclude this public hearing. It'll be considered at next meeting. Bill 20-034 is now closed. Thank you. And there'll be a little bit of a recess before we start our regular legislative session. Thank you.
Good evening, Dr. Bashai. This is Mila Dixon. I just wanted to acknowledge I see you joined us this evening. We're in a bit of a recess before we start at 7:30.
Okay, thank you.
And I'm going to just ask that you keep your mic muted when you're not speaking. Good evening, Dr. Bashai. This is Mila Dixon.
Dr. Bashai, I see you've joined us. Good to hear from you again this evening.
Yeah, I'm ready. I'm going to keep myself on mute, though.
Yep, that's good. Thank you. Colin,
Yes, sir.
good to see you here again as well. It was a pleasure meeting you a week or two ago, whenever it was.
Yes, hopefully everything worked out.
Everything is. Thank you. Be back in touch soon.
Terrific.
Marcy, are you on with us?
I'm here.
Very good. Just checking.
Okay.
Mike's on. Mike's on. Mike's on. Good evening. Chair calls to order legislative session day 20-001. Council, we are still meeting with a modified agenda due to our current health emergency and the COVID-19 pandemic. At this time, I would ask you to please join us in standing for the pledge, followed by this evening's prayer. Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Heavenly Father, we begin this new year with the promise of your strength, courage, and wisdom as we face the challenges that lie ahead. We look to you, Lord, for your hope, joy, and peace. Guide us through tonight's agenda and the discussions to follow. Lord, we pray for all who suffer from the coronavirus. May those who are infected receive the proper treatment and the comfort of your healing presence. May our first responders, caregivers, families, and neighbors be shielded from the onslaught of this virus. Give solace to those who grieve the loss of loved ones. Protect those who strive to find a cure. Restore our communities to wholeness and health. Lord, we ask these things and more in your most holy name. Amen. Agenda item number 4, consideration of petitions, applications, appointments, and nominations. Council appointment, Harford County Cultural Arts Board, Harford Living Treasure nomination of James V. Captain Jim McMahon Jr. Mr. Woods.
Thank you, Mr. President. Mr. President, I move to approve the Harford County Cultural Arts Board's nomination of Captain James V. Captain Jim McMahon Jr. as a Harford Living Treasure.
Second.
I missed that.
A second.
Thank you, Mr. Giangiordano. Been moved and seconded to approve the appointment of Captain Jim as a Harford Living Treasure. May I have comments?
Mr. President.
Mr. Woods.
Oh, thank you, Mr. President. This it's definitely an honor to make that nomination. And I guess almost 12 years ago or 12 years ago now, when the possibility of me joining the council, the very first person that actually talked to me was Captain Jim. And that strong bond grew and became a reality, and just got stronger and stronger throughout the years that we worked together on the council. Sitting next to me for all those years was just, we had a blast. We really did have a good time. And he's a really good guy to work with on this council. Fun to talk to, and always had a way of making me laugh. And then when I ended up becoming the council vice president, I'm like, oh, are you kidding me? I have to do what he did? How am I ever going to pull that off? So big shoes to live up to, and he did a phenomenal job with that, and he's an outstanding council member. So it's definitely an honor to make that motion, and well deserving. Him living the legacy. His parents are both Harford Living Treasures. So, and no more deserving person. I love it when you actually get to see someone that's a Harford County native that lived in the same area their entire life get this honor. So, council, he definitely well worth it. And of course, everyone's going to vote positive for that. So I don't even have to ask you for that. But yeah, thank you, Captain Jim, for your service.
Thank you, Mr. Woods. Anyone else? Mr. Schroeds.
Thank you, Council President. I would just like to say that Captain Jim and I, we joined the council together in 2006. And, it was a great pleasure for me to get to know him and serve on the council together throughout those years. We all know that he is or was the kind of the historian on the council. He had many stories to share, and knew how to tie everything together, especially for the town of Bel Air and around this area in particular. And he was a great community servant. He continues to be that. And of course, he's extremely passionate about his service to through the military and all of his work for the veterans that he continues to do. And we all know and look forward to hearing
the oral history that will be given, he'll be recorded forever, essentially, and those records will be kept in the Harford County Public Library's records. So, you know, we all know that that interview, you know, let's face it, he's going to eat it up. He's going to love every minute of that interview, and we all know that. And that's the Jim that we know. He has plenty to say. He's a great speaker, and that will be captured in the history books forever. So can't think of a better living treasure, and he's kind of one of our own and somebody that I've really gotten to know over the year since I, you know, began serving on the council with him. Thank you. Thank you, Mr. Schroeds. Anyone else? Mr. Beulah.
Thank you, Council President. I'd just like to say there's Captain Jim is very deserving of this award. I know when I first joined the council, he kind of took me under his wing, really helped me out a lot in a lot of areas. And I know how proud he is of his military service and what he does for the veterans here in Harford County. And I just love him. He's a great person, a great man, a great just all the way around. And I know that when he gives that interview, they better have some extra tape because it's going to be lengthy and he's very thorough. So congratulations, Captain Jim.
Thank you, Mr. Beulah. Mr. Wagner.
I wasn't fortunate enough to serve on the council with Captain Jim, but I was fortunate enough to know him all of my life. And in fact, I remember his mom and dad as player. And certainly is echoing everyone's comments tonight. There is no one more deserving than Captain Jim of this this honor to be named Harford Living Treasure. He does have the history that no one else has, and can certainly fill up the books with historical data of Harford County and of Bel Air. And I'm pleased that he was nominated for this. Tell him good luck, and thank you all for doing that.
Thank you, Mr. Wagner. Mr. Jan Giordano.
Well, I guess congratulations to Captain Jim. I didn't get to serve with him on the council because I'm able to see Captain Jim in his seat, and I did specifically make sure I reached out to him and had some conversations with him since I've been on the council. And I do remember many a days driving down Route 924 with Captain Jim sitting outside with his yellow van saying your councilman is in, and he would sit there for hours. And I'm sure people stopped in and saw him and his in his fight to stop the building of Walmart down there on 924 in Plumtree. Very dedicated. He's been fabulous to me since I took over in his seat, and I do wish him all the best, and look forward to hearing all his comments and history when he's inducted. So thank you very much, Council President.
Thank you, Mr. Jan Giordano. Mr. Johnson.
Thank you, Council President. Yeah, I have never served with Captain Jim, and you know, until the council a few years ago, you know, I knew of Captain Jim, but the thing is that, you know, just getting to know a little bit of Captain Jim, he is Harford County, and he's one of those type of people that you would want to sit down with and just let him talk, so that you can get, if you're a history buff, because you know everybody says that Captain Jim's a little long-winded. We know that he's a little long-winded, but he has great information, and he has the historical data that we as citizens of this county should all want to know and recognize. So once again, he is well deserved of this award, and I just look forward to hearing hearing some of his stories. So I appreciate Captain Jim, and that's it.
Thank you, Mr. Johnson. First of all, if you may, I want to thank Ms. Brooks for moving his name forward to the Cultural Arts Board, because I don't know anyone any more deserving. He is a true patriot. He has served his communities and the county for many, many years. And I guess I probably known him the longest, because I can remember as an early teenager seeing him come through the back doors at the Bel Air Bakery with Bob Callahan and different ones from the radio, and just got to know him extremely well over the years, and then kind of lost contact for a while. And the next thing you know, I was able to sit with him on a dais for 4 years and benefit from his knowledge, and truly appreciate him. I want to wish him all the best moving forward, and I truly look forward to meeting him here soon with a couple of my colleagues, because we can't do it all together. But I'm looking forward to the opportunity to place this proclamation in his hands. And I had the opportunity to speak with him a couple of times off and on today. And his last message to me was, I actually had Miss Harris print it off so I could read it to you guys. He says, thank you for the invitation, because we wanted him to be a part of this tonight in some form or fashion, because he has no cell coverage at the farm in Madonna. He said his mother, Selena McMahon, was a biology teacher for 37 years at the Bel Air High School. And his chief emeritus, Mr. Vaughn McMahon, for the Bel Air Police Department, both were Hartford Living Treasures. He says, I'm sorry I couldn't be with you all tonight. Having sat where you are tonight, I know what it means to receive this recognition. I'm deeply moved as a true Hartford County native. Please extend my thanks to all who made this happen, including my high school classmate, Mrs. Charlize Brooks. If I could only be there, Tony may let me sit in my chair one more time. He says, thank you, Captain Jim. So with that, any other comments? It's been moved and seconded to approve Captain Jim as a Hartford Living Treasure. Ms. Dixon, call the roll.
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Giangiordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Beulah.
Aye.
There being 7 votes in the affirmative and 0 in the negative, the appointment is hereby approved of James McMahon for Hartford Living Treasure. Agenda item number 5, special presentations, COVID-19. Tonight, Council, we're pleased to have our new health officer with us, Dr. Bashai. He's officially been in the position now for 4 days, 5 days. Dr. Bashai, good evening, sir.
Thank you, County Council President and members of the council. Marcy Austin is also here, and she has done great service as acting health officer. She will be speaking after I speak about our COVID-19 vaccine program. That is a major point of interest for our health department and for the people of the county. Delivering this vaccines is our top priority. But before she speaks, I wanted to say a few words about the big picture on health and COVID-19. And I want to say why I believe that our health department will be able to lead us from where we are now to where we all want to be. We all know that the year we just went through was horrendous. And my heart goes out to all people in our county who lost loved ones to this virus, as well as those who lost loved ones to suicide and alcoholism and heart attacks and all of the diseases that it is my job to prevent and to control. The fight against human suffering is why I chose my profession. So as you say, this is my 5th day on the job, and I will be updating all of you on our COVID-19 situation and about the vaccines. But first, I really would like to introduce myself and tell you how I intend to lead our health department in its service to our county. So I was born in Tacoma Park, Maryland. I grew up here in Maryland and in New England, and then I went off to college, and my medical degree was from the University of California at San Diego. I got a master's in public health at UCLA. Then I trained and certified in both internal medicine and pediatrics at the Cedars-Sinai Hospital in Beverly Hills. I started practicing emergency medicine, practicing in emergency departments 30 years ago, even though I'm an internist and a pediatrician, and I still practice in an emergency department here in Baltimore County every week. In addition to being a doctor, I'm also a professor of economics and public health. I have a PhD in health economics from the Wharton Business School. And after my PhD, I joined Johns Hopkins School of Public Health and rose to become a full tenured professor there. My research is all about the economics of health departments. I have some slides. I don't know if they can be displayed or not, but part of what I am motivated by is a realization that we in public health know about. If you could show the next slide. We know that in public health, we are able to transform counties and cities in America from unhealthy cities and counties to healthy ones. The slide starts at the far left in the year 1800 and then moves to the right to the year 2010, and it shows how life expectancy moved from 40 years of life expectancy at the bottom left up until where it is now at around 79 years of life expectancy. There's a bend in the curve. There's an elbow in around the year 1950. That was the year that antibiotics really came out. What was keeping our life expectancy short throughout most of our history in the 19th century was tuberculosis, smallpox, scarlet fever, typhoid, and other infections that could be cured by the antibiotics that came out in 1950. But it's very obvious to all of us in public health that the way we conquered these infectious diseases happened without the antibiotics. It happened because we made decisions to spend money on cleaning up our air and our water to get ourselves better housing, better food safety, and that all happened because of choices that we made to build public health departments. And this health department has been part of that transition, and I'm so proud to join it. American public health has this glorious history, but it has not turned in an exemplary performance in 2020. In a global comparison, American public health departments have not done as well as those in other countries. And I've come to Harford County because I believe our profession has to go back to our earlier history when we listened to the people in communities and we met them where they are, try to understand what their assets and their opportunities were, and then use the science of public health to make our health better. So that great mission is why I gave up my job security and my lifetime job tenure at the country's best school of public health to work with you in the state I love, fighting COVID-19 with you and this entire community. I made the decision that more years in a professor's office was not going to transform what I think has gone wrong with American public health. I'm working with all of my team to find out ways to listen to the concerns of people in the county. I will be using social media, the telephone. I'll be using my ears and eyes to hear and listen to what we have going for us. And I will bring to all of us the latest scientific findings, and we will base our approach on evidence on what works best to control disease. I will answer all of your questions to the best of my ability using this evidence on the safety and efficacy of the vaccines that we're having available. I will use science on face masks, science about social distancing, hand hygiene, testing and tracking and isolating. I want to give you the best possible advice. I will calibrate, and I will advise that we calibrate our measures to the intensity of the epidemic. We have a difficult tightrope to balance the need of the most vulnerable people in our county whose survival is threatened by this epidemic. We also need to minimize the harms from the control of the epidemic, and that is not easy. We have to measure the extent of the mental health and physical health harms brought on both by the epidemic itself as well as by our response to the epidemic. But facts can help us, and we can learn from other counties and other places that are struggling along with us. So I want to turn now to the regular report on the status of the epidemic. And if you'll move the next slide along, I'm going to show you today's data. Now, everybody here has a smartphone and a device, and you can just Google search COVID-19 Harford County, and you will see data that is about 1 to 2 days older than what I'm showing you on this curve. same data, just I'm about one day ahead of you with what I'm able to share with you. When you see these curves, and we've been seeing them all year, you see a lot of variability on a day-to-day basis. There's squiggliness. That squiggliness comes because human life is squiggly. We do different things on weekends and weekdays, and the labs test us differently on weekends and weekdays. So we in the health department, we have to take averages and smooth this data to help it make sense to it. But we can do it with your eyes. With your eyes, you can easily see the three waves in the data. We had the first wave ending about the end of May, followed by a second wave ending about September. And now, as you can see on the far right of the curve, we are in our third wave, and it is where we are as of today. If you want to go to this very week, it's a bit of a nail biter. We're on a cliffhanger. We have not yet seen all of the infections that we gave each other over Christmas and New Year's. There was a lot of travel in America. A lot of county residents did leave the county and come back. Some of them brought new cases of COVID with them. We don't see them all yet. So when I average this data out, and if you can show that final slide, I used a locally weighted smoother. You can be very optimistic that as of the 1st of January, we might be coming off of a plateau. And I hope we are, but I'll have to report back to you over the next 2 weeks before we really know whether we've come off of the holidays intact. I do worry that there is still the worst of this ahead of us. We do have a test positivity rate that is climbing slightly over the past few days. It's up to the high 8s right now in our county, and this is off of a stable number of tests. We know that if we start testing sicker people than healthier people, that positivity rate will increase. When I run these tests in the emergency room, I am running them with no change in who I run them on. We have pretty stable populations that we run our tests on. So I do believe that when we see a higher test positivity rate, it does signify that we are not through the worst of this last wave of the epidemic. So you could see this as some bad news. As your public health officer, I have to see some good news here. I have to remind you about what is not happening. This epidemic's natural spread. What would happen if there were somewhere on Earth an unrealistically naive population of people that somehow lived a 2019 lifestyle today? If we in Harford County decided that this was 2019 and we were all going to go back to the way we used to live, this virus would double every 4 days. We saw it doing that in its earliest days when it was starting in Europe and in China. If it doubles every 4 days, and if we go acting as though this is life as usual, this disease would infect 200,000 people in our county. It would infect 4/5 of the residents of this county before it stopped. And that would happen by the middle of March. Our caseload would be 100 times as many as the hospital could handle. 100 times more people would be sick than could fit into our hospitals. We would have an additional 1,700 deaths in the county. This is based on our own number of comorbid patients as well as our age profile. We would not have the ability to host all these funerals for all of the dead bodies if we let down our guard and act as though there is no epidemic. So it's bad right now, but we've avoided what could have happened if we had just gone about our lives. Now, it's not just the policies that are making us avoid the former activities of life. We're doing this because we're smart, and we know that if we go out without our masks, without social distancing, we'll live that life that's unacceptable and all those deaths. So I do want to recognize the heroism of the people of the county. I want to recognize and value the people in our hospitals and our health centers. I want to value the work of the police and fire and rescue workers and the essential workers who are maintaining our food supply, our farmers and grocery stores. I recognize the teachers who are bringing on those remote lessons. But most of all, I want to thank the people of the county. You are the heroes, people of Harford County. When you're aching, as we all are, to be with our loved ones, we want to hug our mom, we want to hug our kids. Heroism to know that we can't. Heroism for see the people of the county donating to our food banks. I see the heroism when we're going over to check on a shut-in neighbor next door. I see the moms and dads sitting through Zoom school with their kids, knowing that the kids want to get out, knowing that there's really no other choice but to go through this for a little bit longer. So I want to thank you all. It is really hard to keep doing these things. We're not done yet, but we do see the light at the end of the tunnel. And I really wanted to thank the county for its real courage and what I see as American patriotism to stick with each other and do these things that we need to do for each other. The COVID fatigue that we feel is real. We cannot let up right now. The only way to dodge those mass funerals is to keep doing this very tiring thing. Well, I want to talk about the good news now, and I want to turn it over to Marcy Austin, who's the deputy health officer, because she's been leading our charge on getting the vaccines out to us, and I will let her deliver that good news for all of us.
Thank you so much, Dr. Bashai. Appreciate that. Good evening, Council President Vincenti and members of the Council. Tonight I'm going to talk about our vaccine plan. All counties in Maryland have started their vaccination initiatives and are currently vaccinating Priority Group 1A, which includes first responders, healthcare workers, and long-term care residents. The Harford County Health Department has published the vaccine priority list on its website, which lines up with the CDC and Maryland Department of Health guidelines in order to keep the community informed. The Health Department will also be publishing coverage rates for the county across all arms of delivery as more people are vaccinated beginning mid-January. We are committed to finding and closing gaps. We are following the state's guidelines for first responders, and they include career, volunteer, commercial, EMS professionals, firefighters, police officers, correctional officers, 911 dispatchers, and frontline judicial personnel. In addition, the Health Department will vaccinate all healthcare workers who are not included in Upper Chesapeake's vaccination plan, which I believe Colin will be discussing next. Scheduling for the clinics works as follows. Lisa Swank or her staff sends an email with a link to register for an appointment for the vaccine to one contact person, not individual staff members, at each agency for first responders and healthcare workers, and that contact is asked to forward the link to their staff. The subject line will read COVID-19 vaccine clinic and the date of the clinic. People are asked to register as soon as they receive the link because we are finding that appointment slots are filling up quickly. If your agency has not received the email with the link by January 31st, please reach out to us. The Harford County Health Department held its first vaccination clinic on Wednesday, December 30th for vaccinators and vaccination staff, clinic staff, to assure they received their vaccines in preparation to administer shots at all future health department clinics. All vaccinators are nurses who are fully trained in vaccine handling, safe injection, counseling, waste disposal, use of masks, gloves, and PPE, as well as handling any immediate side effects. A total of 108 people were vaccinated that day. The first week-long clinic for first responders and healthcare workers began this week, January 4th through the 8th, at Patterson Mill High School, and is being held from 8 a.m. to 5 p.m. Over the course of this week, the Health Department will have used all of the first 1,400 doses it received on December 29th. A total of 298 people were vaccinated yesterday, and 198 were vaccinated today. We received 2,200 doses of Moderna yesterday, and we'll be sending more emails with the links tomorrow for clinics that will be held next week. But as a side note, some emails were sent out today to add 400 additional appointment slots at the Patterson Mill Clinic for this Thursday and Friday, so we can make sure all these vaccines are used by the end of next week. The goal is to roll out the doses the week of or week after we receive them to stay ahead of the game. All vaccine recipients are being scheduled for their second dose at the time they receive their first dose. As background, the Health Department receives notification of the amount of vaccine it will receive each week from the Maryland Department of Health and immediately plans the next clinic dates in order to dispense the vaccine quickly. The vaccine is allocated by the state in proportion to population size. The vaccine we have received so far is Moderna, and the health department has the means to store the vaccine safely. To date, vaccines are coming in slowly. However, we expect bigger shipments in the coming weeks. We are making every effort to make it through Group 1A in January. Once completed, the health department will begin the next priority group, which we will announce and continue to post on our website. CVS and Walgreens pharmacies will receive vaccines directly and will vaccinate all nursing homes and assisted living facilities. Bel Air Health and Rehab Center has vaccines scheduled for Thursday, and Forest Hill Health and Rehab Center started this week. The University of Maryland Upper Chesapeake Health is receiving shipments and vaccinating their own staff at both Upper Chesapeake and Hartford Memorial Hospitals. Again, the health department is covering the healthcare workers that the hospital is not reaching. Finally, the vaccine is not mandatory. To help with decision making, there are many excellent places to get information about the safety and efficacy of the vaccine. The Harford County Health Department website is a resource as well. The health department is monitoring the latest findings about vaccine safety, and any emerging data about safety and efficacy will be passed along through our website. The health department cannot and will not endorse an unsafe vaccine for our residents. The governor's coronavirus webpage does have updated information pertaining to the vaccine and vaccine efforts. It has a dashboard showing the amount of vaccines administered each week and the percentages vaccinated in various regional populations. I will keep the County Executive's Office and Council President Vincenti and the Council informed as things progress in regards to vaccines received, clinics, and progress with nursing homes and assisted living facilities. And if you have any questions about whether the vaccine is right for you when your turn comes, now would be a good time to start asking your healthcare provider. We appreciate patience as we move through this mass vaccination process. Thank you.
Thank you, Marcy, for your update. Council, if you may, or if I may, I'm going to go ahead and bring Colin on as well. Colin, good evening, sir. Colin, do you need to be unmuted?
Thank you. My apologies.
But all right.
Thank you, and Happy New Year, Council President Vincente and members of the County Council. Tonight, I'd like to provide an update on our vaccination efforts, our ongoing community testing program, and I'd like to begin with our current hospital operations. It's been 303 days since the University of Maryland Upper Chesapeake Health began caring for our first COVID-positive patient on March 8th, 2020. Since that time, we've expanded our intensive care capacity and opened multiple COVID patient cohort units with negative air pressure and other safety measures. A typical day at Upper Chesapeake Medical Center includes between 35 and 45 COVID-positive patients, with another 18 to 15 at Hartford Memorial Hospital. In addition to this patient volume, we are admitting non-COVID patients that are far sicker and require greater resources than in previous years in the estimation of our clinical leaders. Further, we have team members that have been exposed in the community or COVID-confirmed cases that must be quarantined and not report for work for an appropriate period of time. These factors can combine on a given day to create a bed capacity constraint that could require a transfer of a patient to another hospital within the state. It has been a challenge of late to find staffed critical care beds throughout the state, and our peer hospitals are facing the same dynamics. Our teams continue to answer the call and battle this pandemic admirably, but we find ourselves in an elongated second surge. There is hope on the horizon, however, as vaccination efforts begin to ramp up. Beginning on December 16th and through this morning, Upper Chesapeake Health has vaccinated 1,615 team members, with another 700 scheduled for vaccination later this week. In fact, there is a vaccination clinic for our staff that is concluding as we speak right now. Beginning tomorrow, our team members that received the Pfizer vaccination in December will begin getting their booster dose, which will push them to the expected 90+% protection. We continue to educate and encourage all of our team members to learn about the vaccines and to strongly consider receiving it when available to them. We have been coordinating with our friends at the Health Department and with the University of Maryland Medical System for community vaccination efforts, and we will assist in any way possible to expedite vaccination while adhering to the CDC ethical vaccination hierarchy. The other important collaboration we have with the Health Department is the COVID testing site. Since March 13th, 2020, the team has collected more than 16,500 samples, most recently operating from the Aberdeen campus of Upper Chesapeake Health. The team has indicated anecdotally that post-Thanksgiving, there has been a noticeable increase in the positivity rate of the patients who were tested at the Aberdeen location, and that increase has continued into the new year. As you know, we altered our operation and now collect samples from 5 days a week and about 750 to 1,000 patients per week. This greater community prevalence is one of the factors that drove the no visitation policy at the hospitals that was instituted in early December. And as a reminder, patients are not allowed to have visitors except under special circumstances, including births, for pediatric patients in end-of-life situations, and for those with disabilities. One bit of testing that we would complete normally this time of year is for the flu. And I'm happy to report that as of today, neither UCMC nor HMH has recorded a single positive flu case, which is a small silver lining for our community and our care teams. Finally, echoing the Health Department, I want to highlight the tremendous collaboration and teamwork being displayed each day across our local healthcare system. The flow and sharing of information, knowledge, resources among the Health Department, physician practices, healthcare facilities, local businesses, the school system, and local government has been nothing short of remarkable. These stakeholders have come together to provide safe and efficient care for our friends, neighbors, and families, and it is truly appreciated. This concludes my report. I'm happy to take any questions that you may have.
Thank you, Colin. Council members? Anyone? Mr. Schroeds?
Yes, is there any way to predict, now that the vaccines are out there, how the trend will go? I realize that we just came off of Christmas and holidays, et cetera, and people were around other people, obviously. So normally that would trend up. How will having vaccines out there over time, maybe, get that curve to go down sharply? Is that something that's likely to happen? And then I have a second question, I guess, for the hospital. And because we're seeing, more COVID patients, what does that do to other patients that may have mental illness, suicide types of things? And how is that affecting? Because all of our beds are being used up by COVID patients. So what do we do with those coming in for all sorts of other things, and those illnesses associated with mental illness is on the rise as well. So how do we handle all that? So I guess those are my two questions that I could think of right now.
Councilman Trode, this is Dr. Bashai. You're asking some two excellent questions. The way to figure in the effect of the vaccine on the epidemic relies on the types of models that we use at Johns Hopkins and models that I've built earlier in my career. I do have a model of the epidemic in our county. Models are only as good as their assumptions. The fact about this available in January in such limited numbers that I don't predict it to have a profound impact on the epidemic throughout January or February. It will really only start to slow the epidemic closer to April, May, or June. I'd be happy to update my model as we get higher and higher coverage rates. But right now, we're only going to cover maybe a third of Marylanders by May. And that's when we might see the brakes get onto this epidemic. So we really do need to slog it out for a few more months. The relief is coming, but the vaccine is not here in the large numbers that we would have needed to put the brakes on this month. As far as mental health goes, it's the job of the health department as well as the hospital to give us all data on the size of the mental health problems, who it's affecting, and methods that we can use to help each other. Yes, obviously the hospital and the mental health professionals that we operate in the health department are part of the solution. But it's our job to tell everybody where these problems are and how we can work together to stem them. I'll turn it over to Colin so he can share what the hospital is doing with its burden of behavioral health.
So we at Hartford Memorial, we have an inpatient behavioral health unit, and the challenge there is just to make sure that we have a confirmed COVID status on patients before we place them in the units, because some of the treatment involves group activities and communal meals and that sort of thing. So there's a sort of an extra layer upon admission just to make sure that we have that status confirmed. Those beds are for behavioral health patients, and therefore our COVID patients are not sort of competing or consuming that resource. As you know, we have the Klein Family Hartford Crisis Center here, which is a great resource that has a variety of tools to help those experiencing mental health issues, whether that's mobile crisis, 24-hour hotline, the urgent care, the bridge clinic, and of course the overnight beds. And so we've been tracking the utilization of those on a given day, just in terms of what bed utilization we have available to us. And again, we've been able to place patients there as needed to address their concerns.
Okay, thank you. I did think of one more question as you all were speaking. Of the vaccines that came into Maryland, what proportion came to Hartford County in comparison to each of the county's populations? Is it proportionate to the populations of each county? And if it appears to be less than proportionate, how do we get more vaccines, or how do we expedite and make it more streamlined so we get the vaccinations that we need for our 265,000 people in Hartford County or so?
This is Dr. Bashai again. The allocations from the state, as of now, are proportional to population size. However, at 5 o'clock today, Governor Hogan made a decision that if a county is slow and not using its vaccines, henceforth, that county will be penalized. So it's the job of our county not to be penalized, and we will meet those requirements. The requirement is that we get through more than 75% of our first week's doses, and we're well on track to achieve that. So we will get our share, and we set up the systems for delivery that will get our share. So I'm confident that we won't get more than our fair share, and we won't get less than our fair share.
Right. On that same note, earlier during another council meeting, I'm sure you're probably listening in, Dr. Bashai, but I think it was Councilman Beulah that asked, or it came up about the temperatures that these vaccines need to be kept in. Are we where we need to be with the temperatures to keep them below freezing? I know it's pretty significantly below that freezing mark, and I know early on there was a little concern that we didn't have the equipment that we needed to keep the vaccine at those temperatures. Is that one of those things, if we're ready to go and other counties aren't, that we could maybe see more vaccines coming here because of that?
So this is Dr. Bashai again. The Moderna vaccine can be stored in a regular, ordinary freezer, which is what the health department has, and we have abundant storage space for the Moderna vaccine for the health department. The Pfizer vaccine really needs the sub-zero freezers, and I believe that the Upper Chesapeake Hospital has access to those. I don't think that finally finding our way through sub-zero freezers would really alter our allocation right now, but I can look into that.
And this is Colin. That's correct. We have been allocated Pfizer doses as well as Moderna vaccines as well, and we do have access to the ultra-low freezers to store the Pfizer vaccine.
Thank you. Thank you.
Anyone else, council? Mr. Wagner?
I do have a number of issues I'd like to speak with the health department and health director about, but I will put those in writing and forward them to you and to your deputy director as well, and I'll share the answers when you send them back to me. But one thing I was concerned in the future at our updates, if you could possibly track some of that mental health piece of it, because we're all rather curious as to how it's affecting general population, certainly our children, just reports based on in a comparison to pre-COVID, if we will. I think those numbers would be helpful, a little bit more than just generalities. So if you could include that in the next presentation, I would appreciate that.
Thank you, Mr. Wagner. Mr. Beulah?
Yes. Thank you, Council President. Dr. Bashar, welcome aboard and a Happy New Year to you. I was reading up on the vaccine, and I think I feel it would be very important for our constituents to know exactly how the vaccines work versus most vaccine in the past. This works a little differently, or a lot differently. Would you mind elaborating and giving a brief description on how the vaccine actually works?
Thank you. I know I'm trying on your patience, but I'll briefly say that yes, this is a different mode of a vaccine because it's called an mRNA vaccine. Essentially, it sends a brief Post-it note, a very short message to our own body cells, and it tells our cells to temporarily put the spike protein on our own cells. So when I got the vaccine, it taught the cells in my muscles to start coating themselves with spike protein. Protein looks like the virus, and my body's immune system saw the spike protein on my cells and started to raise antibodies to the spike protein. Meanwhile, my body's destroyed the actual Post-it note that said, hey, go ahead and make spike protein. The vaccine's completely out of my body now. I just have a few muscle cells that temporarily made some spike protein. Those muscle cells have stopped doing that, and what do I have? I have antibodies now. I don't have enough. I'm going to need my booster shot next Wednesday. When my booster shot gets me, the whole process will repeat. I will temporarily make spike protein. My cells will look like I have virus, but I don't. All I'm doing is making a few spike proteins, and I'm tricking my body's antibodies to raise up against this. This type of mechanism doesn't leave behind residues in my system for a long time. It just helps me make the antibodies, and that's exactly what I want it to do for me. Again, we only have 6 months of experience with the recipients of the vaccines and the trials. It's my job to keep watching what we know about what has happened to those trial recipients. I want to give advice to the people in the county planning pregnancy who are pregnant. That is a tough decision, and we will be getting the best evidence on the safety and efficacy as it goes forward.
But if I may elaborate or just ask a follow-up question, the primary difference between this vaccine and, say, most vaccines of the past, you're not actually getting the disease itself. Is that correct?
I missed that. Say the question again.
The vaccine today, one of the big differences is, unlike vaccines in the past, you're not actually being given the disease itself.
Exactly. You are not getting any live virus or anything that could turn into a live virus. You are simply getting the instructions to make the spike protein, which is all your body needs to train its antibodies. And so it has nothing like getting the disease. And the beauty is that this spike protein is safe to temporarily express and develop immunity. It's the most efficient way to raise immunity against this one little piece of the virus that we want to be immune to. And I will be, Councilman Beulah, I will be coming around the county an opportunity to have sessions with the members of the county. I've already said yes to meditations. I'll be recording some YouTube videos and podcasts to try to get the word out. But everybody who's listening, you've got doctors and health providers, nurse practitioners, please have these discussions with your health professional. Have them now. Get these questions answered now, so when your turn comes, you're ready to go. You've made up your mind.
Thank you, Dr. Bashir.
Thank you, Mr. Beulah. Mr. Johnson?
Thank you, Council President. Dr. Shai, welcome. Happy New Year. Mr. Collin, Happy New Year. And Ms. Austin, Happy New Year. The question I have is there a plan for the citizens of the county to become comfortable with taking the vaccine? Do we have a plan in place to make people feel that the vaccine is going to be safe and effective?
That's a great question, Councilman Johnson. The plan is to listen, and again, I'm a doctor. I will do all the listening I can. I need the entire health professionals in county to plan. My listening will be, what are the concerns? I want to know those concerns. We've already fielded a survey to see how concerned the members of the county are. We had 5,000 responses, and we were heartened that about half of the county residents are ready to get vaccinated as soon as they, another 38% are waiting and seeing. And that's great, because most citizens are going to have to wait anyway. And so by waiting, maybe by the time everybody's turn comes out in the late spring, that waiting is ready. But our plan is to use all of the health professionals to listen to everybody's concerns and ask questions. And again, this might not be for everybody. There are no plans to mandate this vaccine for anybody. Everybody has to feel comfortable with their choice right now. And that's fine. And that's what I respect. And the plan is to listen. We will be especially listening for misinformation. And if we see misinformation spreading in our county, we'll look to its sources and really crowd it out with true information. I think that's the best cure for misinformation. And we have many ways to get the truth out.
Thank you, Doctor. And I have one final question. For this vaccine or for the vaccines that are coming out, I heard, or I know that the virus is mutating. So are these vaccines going to be are they going to be good for the virus that's mutating right now?
Yes, the evidence so far.
I hate to put you on the spot. But it's just something that people are asking.
Yeah, it's an important question. The mutation you're probably talking about is the one that's spreading in the UK and South Africa, the B.1.1.7 mutation. That mutation is not around the spike protein's part that is generating immunity. And the experience so far is that the vaccines are just as effective against the mutant, which is great news. What a relief.
Okay. Well, thank you, Doctor. I appreciate you.
Thank you, Mr. Johnson. Mr. Giangiordano?
Welcome aboard, Dr. Bashai. I just have two quick questions. When you get the vaccination, you get the second shot, you build up the antibodies. What's the difference between that and somebody who's had COVID and has antibodies? How long does the vaccine last? And do we know how long the antibodies last in your system from when you got COVID? I mean, if you had it, are you good for 3 months? Do they know, or is it 6 months? And because I think there's a lot of maybe, I'm immune. I got COVID. I'm not going to catch it again, which might be totally different from getting the vaccinations, which are different. So is there?
Councilman Giangiordano, what we know for sure, given the experience with the vaccine trial, is that the immunity is lasting at the length of time since the trial. So we've only been watching the trial subjects for about the longest of about 5 months, but we're watching them very closely. We do know that the immunity wanes from natural infection. And I will recommend right now that if you've already had COVID-19 and you recovered, that you do seek out and receive the vaccine. I believe it will give you better protection than your natural infection. And when we do have enough vaccine, we will offer it to people who've already had an infection. It is important that we get that high 95% coverage, which we know we get from the vaccine. And when we have enough vaccine, people who've already lived through COVID should rely on the vaccine rather than the natural infection for much more reliable immunity. This will change. The science will change. I will be back updates as we more and we learn more by studying both the cohort that were in the trial as well as the people who are being followed after natural infection. So stay tuned. I'll be updating you.
Okay, thank you. And I know there's one more. Johnson & Johnson's got theirs coming as well, correct? That's looking to get approval maybe in the next month or two. That's a one shot.
That's right. We're so excited. The more vaccines, the better, and we'll take any that we can get as long as they're safe and effective.
Thank you, Dr. Bashai.
Thank you, Councilman Jan Giordano. Colin, if I may, you had mentioned transfers earlier at the hospital. And if I remember correctly, early on, we were receiving patients from other jurisdictions into Harford County. Is that still the case, or are we sending people out?
We have not received, to my knowledge, any transfers from other facilities in the state of late. There have been a couple of instances where we have attempted to make a transfer to the Laurel Regional Hospital, which is a COVID hospital, or to the Baltimore Convention Center. But we are not, as a rule, transferring a lot of patients. It's more a consideration when your critical care beds are all filled. You like to have one in reserve because you don't know what's coming in the door next through the ER. So when that happens, we start to look at, are there candidates to be transferred, and occasionally we do make a transfer, but it's not a common occurrence.
What is our capacity in the critical beds now?
I'd have to circle back with you on the exact numbers of critical care beds. It varies a little bit by staffing, but it's not unusual for us to have 2 critical care beds, ICU intensive care beds, open to start a day at UCMC, and then we have intermediate care beds that we could be 1 to 2 that are open and available to us on a given day to start the day.
Do we still have reserved beds at Harford Memorial?
We have separate ICU and IMC beds at Harford Memorial as well. So they're a little bit smaller unit. The ICU there is a 6-bed unit.
Okay, thank you. Mr. Schroeder.
Thank you again, Council President. Just thought of some more questions here. It seems like the more we engage and talk, the more questions I've been having.
We don't want to go too long.
I know. When are teachers in the lineup to get vaccinated? And when do you think that will be? And I know that I read that Carroll County, I believe, opened up schools a little bit more today, and I realize other jurisdictions have done so around the country as well to start the new year. I realize it's a slippery slope because of what you said earlier about the virus doubling every 4 days. So you got to be careful of that. But I think if we're using all precautions and the teachers get vaccinated, if you were to look in a crystal ball, how do you see that playing out? And I guess another question would be, the health department and the hospital folks, are you in constant contact with Dr. Bolson and those at the school board to figure out that plan of how you would, get the kids back to school?
Thank you, Councilman Schroeder. This is Dr. Bashai. I met with the superintendent today, and we've established our relationship. He obviously has a lot of data about the safety of school opening and using criteria with the State Department of Education. At this time, it didn't appear that he was anywhere close to opening. In terms first question, the education sector, teachers and their support staff are scheduled to be the 1Bs. After we finish with the 1As, this should happen starting as early as potentially February. We will begin to have enough vaccine in the country, in the state, and the county to begin to vaccinate education workers. And the faster we can get through them, the sooner it will be capable of opening those schools. The way we're going to get to open schools, though, is probably not going to be as much from the vaccine this spring. If we're thinking about getting these schools open by April or May, it's going to be part vaccines, but part our own willpower to deal with our fatigue of COVID. We've got to keep our good behaviors up, all of the stuff we hate doing, but we do it anyway. That's how we get to open the schools. We saw what happened when we tried to open them during a high rate of virus transmission. It just doesn't work when there's a high rate of virus. Get the virus down, then go back to school is what more and more counties are learning for the safety, not just of the children, but of the education workers who are putting their lives on the line to go to those schools. Once they get the vaccines, it doesn't change the game. I see that happening by mid to late spring. March or April, we'll see where we are, and the education sector and the health sector will work together to do what's right.
Right. Also, is there a one-stop shop for any residents that may call us? I've been contacted, once these vaccines started rolling out into our community, we're getting questions, at least I am, where do I go? And is there a website, or I wonder if everybody can work together to kind of link to the same spot so everybody kind of knows whether it's a questionnaire of some sort or something that people real quickly can figure out when their turn may be, and then when that happens, where do they go?
That's a great idea. The state website is kind of okay. Our county website is going to get a lot better now that I'm here. I'm working with my information officer because we get a lot of room for improvement on the vaccine information side of our website. Right now, if you get these calls, tell everybody that for all of January, if you're not in a long-term care facility, if you're not a health worker, you can do. And if you are a healthcare worker, the health department is reaching out to you. And if by January 31st you have not heard from the health department or your hospital, there's a problem. But we've got a long list, and we are evaluating how well we are reaching our target of the 1As. Message right now, if you're not a health worker or in long-term care, there's nothing to do, not the 1Bs, and that the education workers and essential workers and people over age 75, and we will find a way to reach them too.
All right, thank you.
And then just Marcy, if you're still on, I know you and I spoke today, Dr. Bashai, you and I spoke this afternoon. But in reference to our testing, or excuse me, our administering ability, we have the manpower to vaccinate more individuals. We're basically waiting on the vaccine, correct?
That's absolutely correct. We have enough nurses, we have enough staff. We're just waiting for the deliveries to be a little bit larger. So we're going to keep up with that as they come along. And
just to let everyone know, sometimes you don't get the information that the vaccine's coming until 24 to 48 hours ahead of time, correct?
Right. The 2,200 doses that we got Monday, we learned about on Sunday. So it's a real quick turnaround, and then we have to just start blasting out emails to schedule the appointments.
Okay,
so
well, listen, I want to thank all three of you for what you do each and every day for the benefit of our citizens in Harford County. And I appreciate you taking the time to be with us, and appreciate my council comments. So thank you very much, and we're going to move on.
Thank you.
Thank you.
Okay, bye.
Agenda item number 6, approval of minutes, legislative day 20-033, December 15th, 2020. Are there any corrections to the minutes? There being no corrections, the minutes stand approved. Number 7, introduction of bills, Bill 21-001, solar energy. Mr. Woods.
Thank you, Mr. President. Bill 20-001, solar energy, introduced by Council President Vincenti at the request of the County Executive. An act to add new definition, community solar energy generation system, CSEGS, Section 267-4, definitions of Article I, general provisions to add new Section A16. Thank you. To add new subsection A16 to Section 267-68. Approval and to repeal and reenact with amendments subsection D of Section 267-69, general design standards, both of Article VIII, design standards for special developments, to add new Section 267-85.2, community solar energy generation systems, CSEGS, to Article VIII, design standards for special developments, and to repeal and reenact with amendments the permitted use chart, transportation, communication, and utilities, all of Part 1, standards of Chapter 267, zoning of the Harford County Code as amended to provide for a definition for community solar energy generation systems, CSEGS, and to allow these uses as special developments requiring administrative approval, to allow CSEGS in all zoning districts except agricultural zoning districts, and to set forth the eligibility requirements and development standards with which CSEGS must comply, and set forth decommissioning provisions and financial assurances related to CSEGS, generally relating to zoning. Introduced, read, first time order posted, and public hearing is scheduled for Tuesday, February 2nd, 2021 at 6:30 p.m.
Thank you, Mr. Woods. Agenda item number 8, business from the president. I hope everyone had a great start to the new year despite COVID. Over the past few days, I've had the opportunity to introduce Dr. Bashai to many of our, municipal leaders, our county leaders, county executive, Major General Kilgo, all the mayors, the sheriff, the state's attorney, superintendent of schools, Angela Rose, the chamber director, trying to just give him a quick introduction to all of our leaders across the county so that when he has an opportunity to make that call, they know who they're talking to. I want to thank again all of those folks for taking the time out of their schedule. We're also going to be meeting with APG again tomorrow, and looking forward to that. On a sad note, Jeannie and I want to wish our deepest condolences to the Burdett family and the Castley family. Recently, Doug Burdett passed away on January 1st at the age of 77. He was a man with strong family values, avid outdoorsman, and a taxidermist. That's how I first met him many years ago. He lived just down the road from me on Aldana Stepney Road. His family, his brother's still there on Aldana Road. Just a really good all-around person. And this past evening, Robert Castley passed away at his home at the age of 95. He was a World War II vet, married to his wife Nancy for 71 years, father of 12, and all the children are known in their own right and very well respected. I want to thank the Castley family for their service, not only to the community, to the county, the state, and to the country. We would ask that you keep both the Burdett and Castley families and friends in your thoughts and prayers. For me, the Castley family is like my own family, so really feel sorry for them. Finally, yesterday, actually, I want to give thanks to Kelly Jar and her team at the Harford Cable Network. They took some time out of their schedule to come to the council chambers yesterday and tape our 2021 legislative address that will be shown on the 12th. So I want to thank them for that. And with that, Mr. Johnson.
Thank you, Council President. I want to wish everyone very happy and hopefully safe 2021. 2020 was an absolute bear, and I'm sure many folks out there are happy to see 2020 go. I just want to send out my condolences to the Castley family. I just heard of the passing of Senator Castley's father. I didn't know him, but I send out my deepest condolences to the entire Castley family. And on another note, I want to send a shout out to the Upper Chesapeake Medical Center, along with the CEO up there, Lyle Sheldon. I've had over the course of these, from the beginning of December up until probably about a week ago, I've had a number of family members that have contracted the coronavirus after Thanksgiving, that Thanksgiving time frame when, like Dr. Brashad says, that, folks get COVID fatigue and they want to be around family members. So I would assume that that's what happened with some members of my family. Thus, some members of my family were in the hospital for nearly a month with COVID. Now, it's easy for us to talk about COVID or, whether COVID is real, or some people say that it's a hoax, or whatever the case may be. But now that it's hit me in a different way, I can tell you 100% emphatically that this disease does not care about anybody. I have a family member that has a pre-existing condition. Now, they say that people with pre-existing conditions, they, once they get COVID, that, that they end up, that their cases of whether they survive the coronavirus or not go down, diminished completely. But that wasn't the case, because the one that had pre-existing condition came through fine, mild conditions. The other family member that came down with coronavirus, no problems at all, none, completely healthy, is now on oxygen, probably for the rest of their lives. For the rest of their lives, and that's just because, the fact that they didn't want to go a holiday without seeing family members or enjoying family and the holidays like in previous years. And we've almost lost them. It was touch and go. It was touch and go. So for everyone out there that does not think that this disease is deadly and it can strike at a moment's notice, trust me, believe me, that it can strike at a moment's notice, and it doesn't care whether you have a pre-existing condition or whether you're healthy and an athlete or whatever the case may be. It does not care. So please, please, everyone out there, take care of yourself, take care of others, wear your mask, wash your hands, and socially distance. I'm not saying this because it's some mantra out there. I'm saying it because now I have lived it. Now it has hit my inner circle. So I'm just pleading with everyone out there, just do the right thing. We're going to get through this. And look, let's have a great 2021. And I appreciate everyone out there. And for that, Council President, I'll yield my time back.
Thank you, Mr. Johnson. Mr. Woods.
Thank you, Mr. President. Welcome back, everyone. Happy New Year. I also want to thank and congratulate all of the volunteer fire companies or new officers that are being elected and putting in office in the next couple of weeks and in the last week or so. Hopefully all the volunteer fire companies have an outstanding year, and thanks for all the members and their officers for their service. Also, Laura and I would like to express our condolences to the Castley family, and especially this time of year and how rough everything is with COVID. The loss of any family member is going to be even harder with how to deal with that. So condolences to them. Thank you.
Thank you, Mr. Woods. Mr. Giangiordano.
Thank you, Council President. I also would like to give my condolences to the Castley family, especially my classmate Lucy Castley and her husband Peter. I did not know Mr. Castley, but I do know all of his kids, and they all are outstanding community members that have given a lot to this community. So my deepest condolences for that. I look forward to working with constituents in District C and also continuing to fight for local businesses in the county. Anything that I can do to help any of the businesses, my office is willing to help. We had some meetings with the state about some funding, so we're still able to get out some information that the state's got money for lower down payments for businesses buying buildings or something. So I'd be more than happy to talk to anybody. So thank you, Council President.
Thank you, Mr. Giangiordano. Mr. Schroeder.
Thank you, Council President. Welcome back, everyone. It's great to be with you all. It seems like around the holidays, we do lose a lot of loved ones and folks that are that we all know so well in our communities. And with that, I want to pass my condolences to the Castley family, the Burdett family, a cousin of mine, Harry McAllister, who's from the Whiteford area, farmer, just loved by so many people. And then my one of my dearest friends, June Atkin, who spent decades at North Hartford High School teaching and then substituting as well, and was just a really big figure for our entire community. We're so lucky that I was able to be part of her very, very special parade for her 90th birthday this past July 4th. And, our entire community came out and went by her home, and it was a total surprise for her. And, never would have we have ever thought that she would be gone right now. She was extremely healthy, but sometimes, you get into that state, you get into the hospital, things don't always go right there. Things settle in your lungs and it's hard to recover from. So we're just all really going to miss Miss Atkin. She was an absolute incredible lady. She was also a Hartford Living treasurer. We're just really going to miss her. And I'm so glad that we were able to pull that surprise off, and I was able to plan that parade for her. Also, another good friend of mine, he's in need of a kidney transplant, and apparently he's looking for a donor that's kind of rarer in nature, and that's Johnny Crow. I know a lot of people know the Crow family in Northern Hartford County, well-known farming family, and Johnny's just a great guy. I've known him for over 20 years, and just a hard-working guy. He has 3 kids, a wife, lives in Norrisville, and there is a Facebook page out there, and you can look it up. It's Young Father Needs Kidney. So check that out, and please consider seeing if you would be eligible. I filled out my application to see if I could be a donor, but he desperately needs your help. Trying to get to some better news here. My daughter, Maddie, I know y'all been following her progress with her badly broken arm from a few months ago. She is having her surgery to remove the rod this Thursday. So please keep her in her prayer in your prayers. You know, she's getting it removed, but I'll tell you that she does have what I think is limited mobility from that break. I don't know that she's going to ever recover from it. And that's without even knowing whether her growth plates were affected. We won't know that for a little while, but it's just crazy how an accident like that can happen when you're not even the type of kid that is it does anything extreme. You know, it was just an accident and she fell and caught herself the wrong way. And just keep her in your prayers. On a little bit of a happier note, or a much happier note, we do have a new member of our family, and our new puppy's name is Scout, and he is an Australian Shepherd. And he's been a lot of fun. We got him New Year's Eve, and he's the cutest little thing, but I will tell you, I didn't know puppies were this much work. I'm the one that pretty much takes him out on a regular basis, especially at night, and I've lost a lot of sleep. It's almost like I've had a kid over again with waking up to change diapers and, you know, to do a bottle. So, I mean, that's pretty cool to have a new puppy. So definitely a nice addition to our house, and hopefully he doesn't chew up everything. Lastly, just want to wish everyone the best in 2021. 2020 was a heck of a year, and hopefully soon it's going to get much better for us. But I do want to say that I concur with our councilman that spoke earlier, that we're all in this together, and we just got to get through it and just be smarter and, you know, think about others and you know, just do what we can so we can all get out of this. So like you said, you know, wear your mask, wash your hands, social distance, you know, care for yourselves, you know, think about all those people that you love, and you don't want to have anything happen to them, you know? So let's get through this. Let's have Harford County be a model of how to, you know, get back to a normal, but it's not really going to be normal, but a smarter normal, so we can just get our kids back to school. So let's do it for them and for all the people that we love in our community. And let's be a leader in Maryland and our country like we are in many other ways. So with that, Happy New Year.
Thank you, Mr. Schroes. Mr. Wagner.
I'd like to wish everyone a happy new year and a healthy one too. And certainly we all hope that 2021 is different than the one we just came out of. I would also like to extend my deepest sympathy to the Castley family. They been a long-time staple in Harford County, and certainly Mr. Castley should be proud of the family that he's raised over those 95 years. And every single one of them is someone to actually be very, very proud of. And they've been a big part of Harford County history. And certainly our deepest sympathy to the entire Castley family. With that, I'll yield my time. Thank you.
Thank you, Mr. Wagner. Mr. Beulah.
Thank you, Council President. Also, I'd like to wish everyone a happy and prosperous and healthy new year. Glad to be back, taking care of business. First, I would like to correct some my comments from the last meeting. I had some tough technical difficulty and was unable to get my comments out correctly. December 8th, on behalf of the Sergeant Alfred B. Hilton Memorial Fund, Roxanne Red Wallace, Dwight Perry, and I had the pleasure of donating $756 to the principal, Cynthia Womack of Edgewood Elementary School, and Tammy Bosley of William Paker and Old Post Elementary School to help with school supplies for their students. And we would also like to, I would also like to thank them on behalf of the Sergeant Alfred B. Hilton Memorial Fund for all that they do to take care of our children, especially in these difficult times. Jean and I would also like to send our deepest and most heartfelt condolences to the Castley family. You know, the family has just a staple here in Harford County, and we will put you in our prayers for comfort and strength during this difficult time. Also, on a sad note, our deepest condolences, Jean and I, go out to the family of Greg Carr. He was a longtime member of Oak Grove, and he just loved people, always had something positive to say, was a part of the music ministry, just a joy to be around. And he will be missed. And keep his family and his wife Tammy in your prayers. And with that, Council President, thank you.
Thank you, Mr. Beulah. Agenda item number 10, comments and input from attending citizens. Ms. Dixon, do we have anyone signed up?
Yes, Mr. President, we have 11 signed up this evening. John Malamo, followed by Kim Novak.
I would remind everyone we're going to stick close to the 3-minute time limit tonight. So you're going to get one notice, and then we'll end the call.
Malamo.
Good evening, sir. It's Council President Vincenti. May I have your name and address for the record, please?
Sir, good evening to you and your colleagues. I wish you all a happy new year. John P. Malamo, 2402 Eagleview Drive, Bel Air, Maryland. Continuing on, the traffic pattern discussed was not included in Exhibit 29, and so was not used in the calculation to demonstrate that no more than 50% of the land upon which the commercial operation is conducted is in the Ag District. Indeed, the hearing examiner found that the requirement met, and quoting, pursuant to exhibit entitled Airport Operations Exhibit submitted by the applicant, a total of 62% of the land commercial airport operation will be located in the general industrial district, with the remaining 38% to be located in the agricultural district. Accordingly, this requirement is met. The exhibit marked Airport Operations Exhibit, Exhibit 29, did not include the traffic pattern with the approach and landing pads. The ruling from the Harford County Circuit Court offered this: Malamo, Perens, but not People's Counsel, suggested in some fashion the Board of Appeals grant of airport owners' request amounts to some form of taking in violation of the Maryland and the United States Constitution. Mr. Malamo has no connection to the airport. He resides a significant distance away in the Bel Air area. The special exception and variance granted herein do not amount to any form of taking. Gentlemen, that is absolutely correct. The court reviewed only the transcript and the exhibits in the record. The special exception in zoning case 5814 did not include any of the airspace and land beneath it for use as a traffic pattern with the approach and landing pads by the Harford County Airport. The court could not consider any of this information as it was never presented in the public hearing. There is, however, a taking. Where does the taking occur? Over every property in the traffic pattern. When did the taking occur? When runway 0119 was commissioned. The county is not immune from any taking claim by any affected resident, particularly so as they have failed to enforce their own code and decisions. On another note, it appears from the FAA NOTAM map that Harford County Airport is now operating with 2 runways, 0119 and runway 1028. Council President Vincenti, could you please let me know if that is the case, and if so, when was the expansion approved by the Board of Appeals? Councilman Schroeds, the airport is in your district. You sponsored legislation to change the code ostensibly for the expansion of Harford County Airport. You opposed the Transource Power Line project for your district because it affected the property rights of your constituents along the path. Are the property rights of your constituents along the Harford County Airport approach and landing paths any less important? Council President Vincenti, you are the representative at large for the county. This is in your district and indeed in your backyard. Are the property rights of those affected important? Councilman Wagner, the western portion of the traffic pattern is in your district. Do you consider the property rights of your constituents in that area important? Gentlemen,
This is about government and governance in Harford County.
Mr. Milano,
This is
please
about
bring your
you.
comments to a close.
Good night.
Good night, sir.
Hello?
Good evening, ma'am. It's Council President Vincenti. May I have your name and address for the record, please?
Yes, it's Kim Novak at 4115 St. Clair Bridge Road in Jarrettsville.
Thank you, ma'am.
When you make decisions on what to shut down, are you actually doing this based on some scientific data that says one activity is more unsafe than another? Is the council looking at multiple sources of unbiased factual data and not information from just one source? Besides inaccurate reporting, how many people who were marked as a COVID death had no pre-existing conditions? Why are those numbers not published? I'm already not a fan of this new health officer, more fear-mongering there for sure, and not painting a true picture about the vaccine itself. No flu this year? Again, there are more reasons to not base your decisions off of one person's opinion or their data interpretation. And you may need to question their credentials too. So council, investigate it before you make decisions. Data shows the elderly are the most effective, yet the younger population is not. So then why are schools closed? Is the sole belief that children will spread the virus to an elderly family member? Then why not keep the elderly separated or give them more access to a vaccine so our children can attend school? Most deaths are from those in nursing homes, which do not see daily visits from children, nor do they cohabitate with them. With knowing it primarily affects the elderly, it would lead a reasonable government to assist those age groups and not warrant a broad shutdown for everyone. At the last meeting, Mr. Johnson, you made the statement that open private schools are just a petri dish waiting to happen. I would like to know what facts you base this on, or if this was just a biased opinion. You can't act on opinions. You say tonight that this now has affected you personally, and you're calling us deniers of COVID. But again, that's your opinion, and your position does not allow you to govern us based on fear or your opinion. You work for us. Your constituents are not willing to live in your fear. Where does COVID exist? It's in aisle 6 in Target. Their store had no social distancing during a packed holiday shopping, yet the small shops are at limited capacity. These high capacity spaces are packed with strangers, not a controlled classroom environment with a teacher. So these stores should have been the first places you shut down, but you didn't. Baltimore closed indoor dining, yet they still allow people to take a gamble with their lives at the casino so the city can get that money. The Ravens can play with COVID, but children's rec sports can't. What I'm describing here is disparity and inequity. It's okay for one group to operate that brings in money to the government, but if it's not a moneymaker, then it's too high risk and it must close. Perhaps the small shops should put a slot machine in their stores so they can stay in business too. There's a new round of PPP money coming to help all the small businesses stay afloat, but again, it's not money for all, and there's disparity there too. The Equal Credit Opportunity Act
Ma'am,
and
please bring your
Section 10
comments to a close.
I will. 1071 of the Dodd-Frank Act says that the fair lending law exclusively focuses on small businesses, which require banks to collect data on the demographics of the borrower, which enables them to identify discrimination and lending and patterns that expose where and to whom lenders offer different types of small
Ma'am, please
business
bring your
credit.
comments to a close.
It shows women and minority business owners have been adversely affected already, and the last round of county stimulus required a
Go
minimum
ahead
of
and
2
disconnect
employees.
the call. Ms. Dixon?
Rachel Caziel, followed by Josh Caziel.
Hello.
Good evening, ma'am. It's Council President Vincenti. May I have your name and record for the, or name and address for the record, please?
Yes, my name is Rachel Kozel. My address is 1106 Emerald Drive, Bel Air, Maryland.
Thank you, ma'am. You can continue.
I have lived in Harford County my entire life. My family has been in this county for generations. We have been proud members of the community and what it stands for. That is no longer the case. You have been elected to represent the people of this county, and yet, as of late, you are not doing so. Our freedoms have been slowly and methodically stripped away from us. What we can and cannot do should be left within each individual's decisions for them to live with the consequences of their actions. The same is with the county's decisions. I implore you to make your decisions now at the county level and not wait for the state level to make them for you. I fear that once this happens, there will be no going back. Own our freedom to make decisions for our county. Do not wait for guidance at the state level. Our citizens are suffering, our small business owners are suffering, and our children are suffering. The mental health of our fellow citizens is in dire need of attention. I have a first grader, 6 years old, and a preschooler, 4 years old. My youngest attends preschool, wearing a mask, and has not had any COVID incidents. My 6-year-old sees her younger sister going to school. This is hard for her. She speaks of having to stare at her computer all day. Yesterday, she was physically ill from the thought, gagging and dry heaving in the bathroom before school. Private schools and daycares are thriving. Schools out of state are in person. Why are we not? I support masks, hand washing, and social distancing, but we can do both. What is the plan to reopen our schools? Other counties in our state are laying out plans to reopen, at least in a hybrid model. It is imperative to the mental well-being of our children to do so. We cannot continue the way things are. I implore you to work with the BOE and the health department to come up with a plan. Keep the decision-making at the county level, and do not wait until the state takes your freedom to choose away. Thank you.
Thank you, ma'am.
Hello?
Good evening, sir. It's Council President Vincenti. May I have your name and address for the record, please?
Yes, sir. This is Josh Kozel, 1106 Emerald Drive, Bel Air, Maryland.
Good evening, sir.
Good evening. Thank you. And in listening to the council's last meeting, one word in your statement must change. That is the word want. It seems that everyone wants a lot, just like someone wanting ice cream. But this word needs to be changed to need. You do not need ice cream, but we do need our children in school and in person. We do need to open to survive as a county. And most importantly, we need our freedom restored. We want to live. Most of you have the conscience to understand what is right and wrong and actually live in reality. Those that do, please step up. Those that do not, like Mr. Johnson's marks last meeting and then this meeting, just step aside and let us move forward. I feel your sympathy, but also tonight, how dare that you speak down to your constituents. Please remember, you do work for us. Mr. Bishai, welcome to the county. I hope that you understand what a great county you are part of now. You've been placed in a tough position for sure. The constant changes to data criteria, data provided, and the moving of goalposts leads to a lot of confusion and an extreme lack of confidence. From a Baltimore Sun article, when you mentioned that you see an opportunity for Hartford's own department to become less reliant on the state and get a closer look at its ground level issues, I had hope until I heard your comments tonight, and it doesn't seem like it's on your radar. We cannot wait until May. It is absolutely not an option. In addition, could you please inform us on what the cycle threshold is for testing completed for Hartford County residents? And if this is playing into the current case demic we are experiencing. In an article, a New York lab reevaluated 794 positive tests from July, which was completed at 40 CT. The one was reran at 35 CT, the positive cases returned nearly half less. And at 30 CT, the cases dropped almost 70%. Moving on, so no flu, that's interesting. And then finally, there was data promised last meeting. Can this please be made public? It was not mentioned tonight. Lastly, I again want to provide an update to the council on our schools. The system is still not doing anything. You asked a lot of questions about schools last meeting. May I suggest you invite both into a meeting to provide an update and answer those questions as opposed to making assumptions? Tonight was the first discussion since June involving parents to discuss a plan to open the schools. Since June. What a waste of time they have been. And I'm not going to dwell on the incompetencies of each member of the school system that was provided to you last meeting. This time I want to tell you a personal story that is still breaking my heart as I read this. This is about the picture that I sent to each one of you this morning. To illustrate for everyone listening, my wife just mentioned it. It was my daughter sitting on a chair next to me in front of the toilet, physically sick, physically dry heaving, and having problems with going to school. Her comments, she does not feel inspired to go to school, but she says she is trying really hard and trying to do extra so that she feels like she has actually achieved something. It hurts her eyes. She does not know any of her friends in class or her teacher.
Josh.
She misses all the extra fun activities. I'll be one more second.
Okay.
Misses all the extra fun and activities like assemblies and award ceremonies and all the laughs and giggles. Why does her sister get to go to preschool and she cannot? My family is who I fight for. And they need more. Our community needs more. Do you stand with the current status quo or do you need more? I will tell you that we all need more. Though everything I have mentioned might not fall under your duties,
Please bring
but is anyone going to stand with, but last sentence, but is anyone going to stand with the people for our liberties? Again, when does your wants become a need? Thank you, sir.
Thank you.
Jill Ferreira, followed by David Ferreira. Followed by David Ferreira.
Bear with me. Hello.
Hello, it's Council President Vincenti. May I have your name and address for the record, please?
I'm Jill Ferrara, 2000 Garden Drive. Wow, flu has been eradicated. Hooray. That's quite shocking, considering it's been around for how long? Almost 100 years. And just an FYI, people who have recovered from the flu have scar tissue from the flu and require lifelong oxygen as well. Last meeting, I was surprised that some council members finally asked significant questions of Marcy Austin, which took way too long, by the way. But I was flabbergasted at the narrative-pushing line of questioning of Councilman Johnson. Mr. Johnson, I must ask, why are you fighting so hard to keep children from returning to school? Why do you insist on portraying children as vile, disgusting, germ-infested petri dishes? Why do you not care about the educational, emotional, and physical needs of the children in your district? Have you spoken to your local schools and EMS departments to understand the impact all these restrictions have caused the youth in your district? Do you even know what the negative impact of virtual learning has had on student grades in your district? Per Ms. Austin, parochial schools have only had a few cases here and there, but for some reason, you insist on pushing the narrative that school-age children are the reason for the surge in cases. Have you even looked at the Harford County Health Department site that shows school-age children only account for 11% of all cases in the county? Actually, all council members should know this information, considering you are the Board of Health for Harford County. It is absolutely shocking to see how little all of you know about what is happening in your district and this county. Equally disturbing is the lack of answers Ms. Austin had in response to your questions. The way our county and school system has treated our children is nothing short of child abuse. And as a mother, I will no longer stand for it. If I were to mentally abuse my child the way this county has, he would be ripped from my home. It has been almost a year, and I have seen no plans on how to move forward. We have more understanding of this virus, but it remains stagnant. At some point, the state of emergency must end. It most certainly can't go on forever. Then what? Does Harford County have a recovery plan? If so, I would like a copy. If not, why? If you have failed to plan for this fallout that is inevitable to occur, then you all have failed as citizens of this county and the oath you took to your office. What programs will this county implement to assist students who have suffered educational deficits? How will this county help those citizens who have been unable to pay their rent, mortgage, utilities for almost a year when the moratorium is no longer in place? I hardly think those corporations, landlords, etc., will forgive those debts. Even if a payment plan is offered, these people will have this debt placed on top of their normal bills that they are already struggling to pay and probably will not see the light at the end of the tunnel for many years to come.
Ms. Ferrara,
If they
please
make
bring
it
your
to the
comments
end
to a close.
without taking drastic measures. I'm almost finished. We have already seen an increase in mental health issues now, What do you think it will be in the months and years to come when the rug is pulled out from under them? Is there a recovery plan for this? If so, I would like
Ferrara,
copies.
please bring your
If not,
comments to a close.
again, why? I will conclude with this. Mr. Giangiordano, you are the councilman from my district. I am watching closely on how you are handling this situation and representing your constituents for the upcoming 2022 election. And Mr. Vincenti, I will be expecting an email with answers to my questions. Thank you.
Hello.
Good evening, sir. It's Council President Vincenti. May I have your name and address for the record, please?
Sure. David Ferrara, 2000 Garden Drive. Quick statement about John Malamo from the last meeting. I meant no disrespect towards him or his efforts. I just wanted to recognize his passion for his cause and voice my support to him.
Appreciate that.
But now, yeah, I just wanted that to get out there. I didn't want him to be offended by that. But good evening, Council President and Council members. I am once again speaking to you on the subject of the scamdemic. Now, I call it a scamdemic because with the data available, everything that has been propagated has been wrong, skewed, or based on no factual evidence, mostly just opinion. First, the lockdowns don't work. They only hinder the citizens and their ability to work and earn a living. Second, masks don't work. They are causing more damage than good. Third, almost all elected officials in counties, states, and federal governments have broken their own rules, regulations, and mandates for themselves, and ironically, with no outbreaks directly related to them. I find it completely absurd as well as ignorant that you all are still meeting virtually when you have already gathered, partied, and held events in the past year. Mind you, with hundreds of people, no masks and no social distancing. The time has come, albeit way late, to admit you and everyone else were wrong in the actions you took. I will admit that upon first hearing about the China virus, I was also scared and had no answers. I also agree that the first response was warranted, but after a month or so and educating myself on the data, I could see clearly that this was, as I said, a scamdemic. Let's not forget where this virus came from. In case you don't know or have forgotten, from almost a year ago, it was 100% created in a virology lab in Wuhan, China. The data has and still clearly shows there is a 99% survival rate to most Americans. The clearly vulnerable are those of age 74 and older, as well as individuals with 2 or more underlying conditions. Other counties, as well as states and countries, have proven that mass lockdowns, restrictions, and business shutdowns are not necessary, nor do they have any effect on the spread of this not so deadly virus. It is high time you all step up, stand up to anyone wanting to continue making the same mistakes over and over. Let's face it, when it's all over, it's your butts on the line. Be the leaders you were elected for and end this now to save what little credit you have left. By the way, the vaccine will improve the survival rate from 99.7% to 99.8%. And China virus eradicated the flu based on your new expert. Amazing. Thank you for your time. Have a great night.
Thank you, sir.
Stella Peters, followed by Stephen Myers.
Hello?
Good evening, ma'am. It's Council President Vincenti. May I have your name and address for the record, please?
Oh, yes, just a minute, please. Let me mute you. Stella Peters, followed by...
Are you there, ma'am?
Yes. Yes, Stella Peters, 3714 Federal Lane.
Yes, ma'am.
On March 12, 2020, my husband and I were sitting on the bleachers with our fellow senior parents waiting to cheer on our son. It was the first game of the season, and there was excitement in the air. As parents of 2020 high school seniors, we were looking forward to an amazing year of sports, proms, and graduations. I never would have imagined
that in a split second, the governor and our local representatives would be able to rob us from those memorable moments. We were told that a novel virus would kill us and that we needed to remain in our homes for 2 weeks to flatten the curve. As time progressed, 2 weeks turned into 10 months, with no hope in sight to return to school. There would be no prom and no graduation for the class of 2020. By June, it was determined that the curve had been flattened, but apparently the politicians were enjoying the emergency stimulus money that they were continually receiving. It's hard to believe that 2020 is behind us and that almost a year later, our children are still not back in school. As the mother of 2020 graduates, I know firsthand the negative effects that our children have suffered. Our schools remain closed, our children continue to suffer, and our families continue to be torn apart. We don't deny that there is a virus and that many people have died from it. We also know that many people have lost their businesses and jobs, not to mention their lives due to anxiety and suicide. We know the numbers. We know how many people have tested positive and which states have the most cases. We even know how many people are in the hospital. The numbers are continually shoved down our throats by the media and politicians to advance their political agendas, and these numbers are being used to justify a new wave of lockdowns and school closures. Lockdowns are harmful to our communities. They are destroying lives. Children are especially prone to the unintended consequences of these irresponsible decisions. You are sacrificing our youth, their lives and their futures for a virus with a 99% survival rate. I have seen the negative effects of the lockdowns firsthand. My children lost 2 friends that committed suicide in 2020, 3 weeks apart from each other, and the suicide rates keep rising. Our children and our youth feel that they have no future. They feel lonely and isolated. Children are struggling due to lack of resources that are typically offered by schools. Schools provide students with socialization that is critical to healthy living. They provide counseling, lunches, physical activity, speech therapy, and many other programs that are essential for their health and well-being. When schools are closed, students only have access to the learning aspect of school. And there's plenty of evidence that suggests that students are falling behind and not learning while studying online.
Ms. Peters,
In fact,
please bring your comments to a close.
Even college students are struggling. And if they are having a difficult time, can you imagine the negative effects on our young students? It's horrific. For the sake of our future and the future of our children, you must reopen our schools. Mr. Beulah, you were elected by the
Ms.
people
Peters,
for the people.
Please bring
We
your
did not
comments
hire
to a
you
close.
to give us your opinion, but to represent us. Open our schools now. Thank you.
Good evening.
Hello?
Good evening, sir. It's Council President Vincenti. May I have your name and address for the record, please? Can you speak?
Most others,
There you go. Thank you.
most others would say thank you for the opportunity to speak, but that seems like a ridiculous premise to me. After all, it's our right to be heard by the people we've elected to represent us. I've lived in Harford County all 36 years of my life, with the exception of when I was away for college. Both of my parents grew up in Harford County. In my travels throughout the country, whenever people would ask me where I'm from, I would always say Harford County, Maryland, out of pride, not Baltimore as most people would do, out of ease of recognition. After all, one of the greatest advantages of living in Harford County is you're not living in Baltimore. This has, however, changed over the past years, little by little, and more dramatically since March of last year. Although I'd previously given it some thought, I was not planning on moving at this point in my life. But in November, I sold my house and bought a camper so I can travel the country in order to find a freer place to live. A place where the government takes liberty seriously and has the decency to allow its citizens to think for and make decisions for themselves instead of being told what they can and can't do. A place where public officials look at the circumstances and realities of the situation, use critical thinking to make reasonable decisions rather than just blindly following the advice of other levels of government and public officials, or simply defaulting to their recommendations, especially when there's conflicting evidence regarding what is and what is not working. I'm by no means underestimating the complexity and difficulty in making such decisions, but what works for one region of a county or state
may not be best for the next one over. It's your jobs to make these decisions. And I honestly have lost faith in the leaders of this county, past and present, to just do what's right for the people. Well, I may be an outlier in my desire to leave, but I have to believe there are others that want to do the same. And I know that there are many that at least feel the same way. But to be honest, my bigger concern is not even the current situation caused by the pandemic. It's what will happen with the next occasion that spurs power grabs from various levels of government, and what this county's role will be in being a leader or just telling the people to be sheep, because we don't know what's best for ourselves, or that we can't comprehend the information behind the decision making. If I thought that Hartford County was still a place where I felt empowered to have control over all aspects of my life, this would be a different conversation, or not a conversation at all. Bottom line is that this county simply is not the place that I've had so much pride to call home for all of my life. On another note, I'd like to recommend that the council consider a Q&A session instead of just having people make comments, only for them not to be addressed, let alone having the appearance of being listened to. And in closing, I've set no expectations for any reaction to the comments I've made here today. I'm kind of just considering this to be my exit interview and leaving the county and state, which I find to be a very sad fact. So best of luck to everybody who's going to need it.
Thank you, Mr. Myers.
Melissa Hahn, followed by Giovanni Ferreira.
Hello?
Good evening, ma'am. It's Council President Vincenti. May I have your name and address for the record, please?
Hi, my name is Melissa Hahn. The address is 211 Paulsville Road, Paulsville, Maryland, 21132.
Thank you. Continue, ma'am.
Members of the County Council, I'm a parent of two children, one in 8th grade and one in 11th grade. Our children are struggling mentally and socially, and they are falling behind. Schools all over the country have successfully been back since August. There's absolutely no good reason that Hartford County students should not be in their schools being taught by a teacher 5 days a week. Per the CDC, COVID-19 poses low risk to school-age children. In-person learning is the best interest of students when compared to virtual learning. Not being in school, again, per the CDC, can have adverse impacts on students' social, emotional, behavioral, and mental health. The unique and critical role that schools play makes them a priority for reopening and remaining open. The isolation that these children are dealing with is difficult to deal with as an adult, much less expecting children that thrive on play and social interaction to successfully deal with. This is causing anxiety, depression, and insecurity in many children, including my own. Failing grades is causing them to feel like failures, when really it's the schools that are failing our children. Virtual school is not teaching my children and so many other children. I have noticed my 8th graders' mental health steadily decline since returning to virtual school in the fall. A mom reached out to me yesterday about her 12-year-old daughter that tried to commit suicide because she is struggling, as so many are. Children need to be surrounded by peers and in a classroom and interacting with other children. We know of about 7 kids that committed suicide. That's more than have died because of this virus. How many like this child that I speak of have fallen?
Ma'am, are you there? Ma'am?
Yeah.
There you are. Okay.
Hello?
Yes, you there? We thought we lost you.
Yeah. Yes, no, I'm here.
Go ahead.
What was the last thing that you heard that I said? I'm sorry.
I don't know. I was trying to get you back on. I'm sorry. The last
That's
thing
okay.
the last thing I took notes on were children's suicides.
Okay. Yes, we had heard there were 7 kids that committed suicide. That's more than have died because of this virus. How many like this child that I speak of have fallen through the cracks because, thank God, they didn't succeed. Enough is enough. It's way past the time to get these kids and make their kids, to make these kids and their education a priority. These kids are suffering. How many more have to die? Mr. Schroeds, I voted for you to be my representative and to be my voice. Please do just that. Get these kids back in school. Our children deserve better than this. Thank you for your time.
Thank you, ma'am. Good evening, sir. Name and address for the record, please.
Giovanni Ferrara of 2000 Garden Drive.
Good evening.
Good evening. Tonight, I'm going to speak on how not being in school has impacted me personally. I have suffered from ADHD ever since I can remember. My parents and I decided that Hartford Tech would be a better suited school for me since I would have more hands-on instruction. But unfortunately, I was only allowed half a school year that best matched my learning needs. Now I have been denied that privilege for the remainder of the year and beginning of my second year. I find myself depressed, not motivated, and struggling to keep up. I started this school year taking medication for my ADHD, but had to be taken off of it because I almost completely stopped eating and couldn't sleep because of the inactivity of virtual learning. Apparently, for this medication to work its way out of my system, I need to be more active throughout the day. So now, not only have I been denied the educational advantages of being in a hands-on school, but I have also lost the additional help the medication gave me. I was an average student, but with the way virtual learning is going, I have fallen behind, which makes my struggles even harder and makes me feel like a failure. When you feel like a failure, it makes it hard to be motivated to get up for school, to just even feel worse about yourself. My only hope is that you all will do the right thing and get us back in school, or at least allow the students who want to return the option to do so. I yield the rest of my time to Jill Ferrara.
I just want to make note, Mr. Schroes, I have watched you on your phone. I find that extremely disrespectful. And I find it absolutely ridiculous that we get 3 minutes, but we can hear about you. Council members talk about whatever you want, your dog, your whatever. And by the way, Ms. Novak did not get a full 3 minutes.
Yes,
Goodbye.
you did, ma'am. Good night.
Our last speaker this evening is April Newton.
Hello.
Good evening, ma'am. It's Council President Vincenti. May I have your name and address for the record, please?
Yes, this is April Newton, 316 Wood Duck Court, Havre de Grace.
Yes, ma'am.
Thank you for the opportunity to be heard this evening. I have 2 children who have already graduated from HCPS and a 14-year-old who is in his freshman year. I commend the teachers at my son's school for doing the best they can right now. It is never my intention to bash teachers. In fact, I know many who aren't afraid to go back to school and want to be there. We are fortunate in this house that I'm able to be here during the day. Most days, I'm my son's only contact. The other day, he said to me, all we do all day is push buttons. There's no interaction. When asked how he's doing, I say, okay, but as time goes by, I worry that he, along with all the kids, are a little less okay each day. So yes, kids need to be back in school. You're tired of hearing it. We're tired of saying it. And what we're really tired of is not getting any answers or seeing any forward progress on a plan to make that happen. There's a whole lot of passing the buck going on. The governor, state superintendent, CDC, WHO, and just about every medical or pediatric expert there is agrees that kids are better off in school, and that in fact schools are not proven vectors of this illness as it was once thought. Yet the governor passes control of the county blames the health department blames the state, and around we go. Meanwhile, schools not only in this state but in this county are making some form of in-person learning happen, seemingly with little to none of the dire consequences that have been forecast. Schools all over the country have been open for months. Many more have plans to open in the near future, if not now. All we want is an explanation and a plan to move forward. Time after time, our Board of Education has demonstrated their lack of willingness to even have the conversation, let alone work on a plan. They have thrown up their hands and said it's too hard, so let's not even try. Maybe we can't open next week or the week after, but is there even a plan for when it is time? Do I think it's easy? Do I have an idea how to make it happen? No, but it's not my job to do that. That's why we have these elected officials. We don't need to reinvent the wheel. How about contact any of the places who are successfully getting kids in school and see what they're doing, asking for help, talking to parents who may have experience in their jobs keeping people in person and safe. HCPS recently received over $7 million for COVID-related expenses. Is any of that being used to facilitate reopening? We are frustrated, we are willing to help, and we deserve answers. We are told if we want our kids to go back to school that we are lazy, unwilling to deal with them, teacher haters, and that we have blood on our hands. The situation is even more divisive than our current political climate. As has been discussed, it cannot be stated enough. The mental health effects cannot be stressed enough. We all need to ask ourselves, when the first child in this county succumbs to suicide as a result of being locked out of school, did I do enough? I do not say that lightly. I hope and pray it never gets to that point, but it has already happened in this country and in our state. I implore you as elected officials and employees of we the taxpaying citizens to work together and do whatever you can to help make a real plan that can get our children in a healthier place in schools and moving forward. We are frustrated, we're willing to help, and we deserve answers. Thank you.
Thank you, ma'am.
Mr. President, there is no one else signed up to speak this evening.
Did we not get comments from Mr. Zimmerman or contact from Mr. Zimmerman?
No, Mr. President, we did not.
All right, Ms. Dixon, thank you. With no one else signed up to speak, this meeting will be adjourned. Thank you.